pulmonary physical findings, looking at various diseases, first being consolidation, under the headings of percussion. Under percussion, there is dullness. Looking at phrenitis, yes, it is present. Trachea deviation is not very prominent. And now looking at the auscultation findings, there is positive late inspiration, crackles, and there is positive egophony. Looking at other auscultatory findings, there is positive bronchophony and positive whispered pectoraloquy. Pleural effusion. On percussing, there is dullness. There is no phrenitis. Trachea deviation is not prominent. On auscultations, decreased breath sounds over effusion. The next illness, that is the bronchial obstruction. On percussion, there is dullness. There is no phrenitis. And on trachea deviation, it is towards the lesion. Auscultatory findings, there is decreased breath sound over effusion. The next disease is the pneumothorax. On percussion, it is hyperresonant. Looking at phrenitis, there is no phrenitis, and trachea deviation is towards the lesion, that is the diaphragm and trachea fill the space that is left by the lung collapse. On auscultatory findings, there is decreased breath sounds. Next being tension pneumothorax. On percussion, there is hyperresonance and there is no phrenitis, and trachea deviation is away from the lesion. There is increased pressure that pushes the mediastinum to the opposite side. Auscultatory findings being decreased breath sounds. The next disease being emphysema. On percussion, there is hyperresonant. Phrenitis, it is reduced, and trachea deviation is not prominent. Auscultatory findings is decreased breath sound and wheezing. Asthma. On percussion, it is hyperresonant. Phrenitis is reduced. Trachea deviation is not very prominent, and auscultatory findings being decreased breath sounds and positive wheezing. Looking at atelectasis. On percussion, there is dullness. Phrenitis is there is no phrenitis. Trachea deviation is towards the lesion. Auscultatory findings is positive or negative rails. Chronic bronchitis. On percussion, phrenitis and tracheal division, it is not prominent. And auscultation, there is positive bronchi, that is low pitch, and positive wheezing.